Welcome to RSCH503, Research Methods and Biostatistics, a 3-credit graduate course offered by Drexel University College of Nursing and Health Professions. Research, the systematic, rigorous inquiry to refine existing knowledge and/or to generate new knowledge, is the foundation for evidence-based practice, or EBP. Nursing's unique body of knowledge evolves from well-designed and executed research investigations. There are two types of research, applied and basic. Basic research is scientific investigation for the pursuit of knowledge for knowledge's sake, to generate or refine theory or to build constructs. Applied research is scientific investigation to generate knowledge that will directly influence or improve clinical practice. One hears the word empiricism often in research. Empiricism is a theory that knowledge comes primarily from sensory experiences, thus an emphasis on experience and evidence. Nurse researchers employ quantitative, qualitative, outcomes, and intervention research methods. Logic is the science that studies the formal processes used in thinking and reasoning. Logistic reasoning breaks down the whole into its various parts to understand. Inductive reasoning moves from specifics to the more general. Deductive reasoning, in contrast, moves from the general to the specific. A hypothesis is a statement of the proposed relationship between two or more variables. Nursing is an evolving profession, with nurses increasingly engaged in research programs that will frame the discipline's body of knowledge. Nursing science is advancing, with original studies as well as replication studies undertaken to develop a coherent, unique, disciplinary, evidence-based practice foundation. Theory structures ideas used to understand the empirical world. Nursing theories consist of sets of defined and interrelated concepts that present a systematic view of a phenomenon of interest. A classic example of a theory is that of stress, as developed by Hans Selye, a theory devised to help explain the physical effects of illness on humans. Historically, nursing knowledge was acquired through tradition, authority, borrowing from other disciplines, trial and error, experience, intuition and reasoning, and mentorship. As nursing advances, theory is increasingly used to understand phenomena of interest to the field. One's philosophy, that broad, global explanation of the world, influences one's knowledge base. Nursing has a rich philosophical tradition that holds that humans are holistic, rational, and responsible, and that they desire health. These tenets impact nurses' perceptions, enabling nurses to appreciate and accept patients' differing worldviews and health beliefs. Given that nurses provide care, the acquisition of evidence-based research as the foundation of quality practice is paramount. Evidence-based practice, or EBP, is generated from the integration of the best research evidence with clinical expertise and patient values and needs in the delivery of quality, cost-effective care. Simply put, EBP is the provision of care based on research findings. Nursing research will continue to focus on 4 areas as the profession advances toward evidence-based practice. These areas include description, that is, understanding phenomena and relationships among them; explanation, or clarification of relationships; prediction, estimating the probability of an outcome in a specific situation; and control. If an outcome can be predicted, then can a situation be controlled to produce the outcome? Broadly speaking, there are 2 overall types of research, quantitative and qualitative. Nurse researchers use both types. Quantitative research uses numerical data to describe variables, examine variable relationships, and explore interactions among and between variables. Qualitative research uses language and a more holistic approach to fully appreciate human experiences. The 4 quantitative research methods used in nursing include: first, descriptive research, research that describes characteristics of individuals, groups, or situations. The second is correlational research, systematic investigation of relationships between or among 2 or more variables that have been identified in theories or observed in practice, or both. The third quantitative research method is quasi-experimental. Such research may be conducted to identify causal relationships, or to explore the significance of causal relationships, or to clarify why certain events happen, or a combination of these purposes. Quasi-experimental design has less control than experimental design. The fourth method is experimental, objective, systematic, controlled study for the purpose of predicting and controlling phenomena. Note that this method includes controlled manipulation of at least one independent variable, treatment given to an experimental group, and either random selection of subjects or random assignment of subjects to groups. Qualitative methods vary and include phenomenology, grounded theory, ethnography, exploratory descriptive, and historical study. Outcomes research and intervention research are 2 additional categories of investigation common in nursing and health care. Outcomes research examines the results of care and measures the changes in care status of patients. Additional questions include: will specific services improve consumers' health? Or, is health care both cost-effective and high quality? Intervention research explores the effectiveness of an intervention or treatment in achieving a desired outcome in a natural setting. Research findings are voluminous. Practitioners gain from processes that synthesize and publish research evidence. Systematic review is the use of specific systematic methods to identify, select, critically appraise, and synthesize evidence to address a particular practice problem. Meta-analyses, by contrast, is the synthesis or pooling of results from previous studies using statistical analysis to determine the effect of an intervention or the strength of a relationship. Metasynthesis is the systematic compiling and integration of qualitative studies to expand understanding and develop a unique interpretation of the study's findings in a selective area. Mixed methods systematic review is the synthesis of findings from independent studies conducted with a variety of methods, both qualitative and quantitative, to determine the current knowledge in a select area. This presentation was prepared for graduate nursing students at Drexel University College of Nursing and Health Professions. The primary book used in this research course is The Practice of Nursing Research, Appraisal, Synthesis, and Generation of Evidence, 2017, by Jennifer R. Gray, Susan K. Grove, and Suzanne Sutherland. This book is published by Elsevier Saunders, St. Louis, Missouri.